Hi everyone, I'm Dr. Larry Malerba and welcome back to the All Things Homeopathy Materia Medica series. Today I'll be talking about the homeopathic remedy Aconitum Napellus. Otherwise known as monk's hood or wolfsbane, aconite is a member of the ranunculacea family. In its crude form, aconite is a highly toxic plant. In its homeopathic form, it's completely harmless. Just like belladonna, aconite has a reputation for being most useful for acute conditions with intense symptoms. It fits both mental and physical conditions that flare up suddenly and dramatically. And although it's given primarily for acute ailments, it can also be indicated for chronic problems too. So with that said, let's get started.
Okay, now, so the main idea or theme that runs throughout much of aconite's pathology is a sudden and intensely frightened reaction to a perceived threat. And by far the dominant fear that is provoked is a fear of death. And it's not just a fear, it's an intense fright. It's a state of terror. The person in an aconite state is acutely terror stricken. They're overwhelmed by the fear that death is upon them. Death isn't just down the road. The feeling is that death is imminent. They believe that they are about to die, either right now or very soon. This sense of imminent danger is expressed in the rubrics delusion that he is about to die and presentiment of death predicts the time of his death. These are the people who run to the emergency room in an acute state of panic in the middle of the night, convinced that they're going to die. Since the symptoms of a panic attack can be easily mistaken for a heart attack, many such patients believe that they're actually having a heart attack. But they don't just think that they're having a heart attack, they believe that they are having a heart attack and they're going to die. Now, this dramatic fear of death is a dominant feature of aconite's mental pathology and its physical pathology, too. And this is reflected in the following rubrics: fear of death, fear of death with anxiety, fear of death during fever, fear of death with heart complaints, fear of death during labor and delivery, fear of death during palpitations, fear of death during pregnancy, impending fear of death, and sudden fear of death. Of course, this sudden acute state of intense fear and terror can have its etiology in any number of frightening events. Think of a car accident where someone sees their life flash before their eyes, or a woman who was raped, or a terrorist attack, or an earthquake, or living in a war zone. However, the original trigger doesn't have to be as dramatic and obvious as these examples. Perhaps it's a child who is threatened by an abusive parent, or a patient who's been diagnosed with having a terminal illness. It doesn't really matter what the trigger was. What does matter is the acuteness and intensity of the individual's reaction to the frightening event. Now, aconite can also fit other fears, some of which are obviously connected to the original trauma, and others which are not. Some of those fears listed prominently in the repertory include agoraphobia, fear of accidents, fear of crowds, fear of doctors and dentists, fear of earthquakes, fear of fainting, fear of flying, fear of ghosts, fear that something will happen, anxiety about the future, fear of suffocation, claustrophobia, and fear of tunnels. All of these fears represent potential threats in the mind of the person who needs aconite. Now, if not properly dealt with, this acute type of terrified reaction can quickly become recurrent or chronic. Aconite is one of the main remedies for post traumatic stress disorder, which is just another way of labeling a situation involving an individual who's never been well since some frightening event. Once the problem sets in and takes hold of the vital force, it tends to manifest thereafter as a hair trigger for similar events that can remind the person of the original trauma. So, one of the consequences of having been terror stricken once can be a newly developed sensitivity to additional triggers that may not be nearly as severe as the original trigger, but that nevertheless provoke a similarly dramatic response. So, for example, a person who was once held up at gunpoint and robbed may now have a panic attack when viewing a similar scene depicted in a movie. Of course, this is the very essence of PTSD. So, in such cases, whether we call it fear, fright, terror, panic attacks, PTSD, an anxiety disorder, a phobia, or emotional trauma, the bottom line remains the same. The original trauma was so intense and frightening that it left a mark, or a scar, if you will, on the vital force, rendering it susceptible to developing reactions of a similar nature when provoked by conditions or situations reminiscent of the original event. Now, in either case, whether the condition is acute or chronic, we also tend to see additional symptoms typical of someone who's having a panic attack, where the fight or flight response is kicked in and the adrenaline is pumping. With aconite, the emphasis is much more weighted toward the flight aspect of this response. Symptoms that reflect this can include great restlessness, heart palpitations, anxious breathing, shortness of breath, and either paleness of the face or flushing of the face. The aconite state is violent, sudden, and intense, and the person is frightened and restless. When this state becomes chronic, it can manifest episodically, or it can present as an ongoing state of anxious nervousness. This occurs in cases where, as the repertory rubric tells us, the fear of the original fright remains. In this chronic state, aconite may have learned how to cope with and adapt to his ongoing feelings of stress and agitation. Nevertheless, there are usually signs that tell us that something is still amiss. The person may be nervous, worried, and may even bite his nails. He may be talkative, excitable, impatient, hurried, and irritable. In some cases, his anxiety may come across as shyness or timidity. His anxiety or fear can be triggered by trifles, but he still manages to somehow keep himself together. His fear and symptoms may be episodic, flaring up suddenly and without warning, and then settling down just as quickly. Sometimes it all breaks through into a full blown panic attack. This is when he may visit the ER once again, convinced that he's having a heart attack yet again. At his worst, he's frantic and inconsolable from the intensity of his fright, his pain, and or his symptoms. He may scream in fright from his pains. In this heightened state of fear, his senses are more acute. He may be sensitive to various stimuli, such as noise, odors, taste, touch, and even music. In some cases, there's a desire for light or a desire for company. In most cases, there's an aversion to company. Given this amped up state, it makes sense that Aconite's sleep would be disturbed. He may wake from fright after falling asleep, and there can be sleepwalking and sleep talking. He may have anxious, frightful dreams, and his dreams can be clairvoyant, sometimes predicting future events. Okay, now, etiologic factors or triggers that can precipitate an aconite state include fright, physical or emotional trauma, shock, and injury. Another well documented factor that can bring on an aconite illness is wind, especially cold wind, and even more so, cold, dry wind. And one additional lesser known trigger is exposure to the heat of the sun. Aconite fits the earliest stages of sudden, acute, violent conditions that develop rapidly. Once a condition has had time to progress to later stages, we usually consider different remedies. One such remedy, commonly indicated after aconite, is hepar sulph. We think of aconite in the early phases of colds, flu, respiratory infections, croup, pneumonia, cystitis, UTIs, and more, especially when there is rapidly developing inflammation or infection soon after a fright, shock, or exposure to cold wind. Aconite symptoms are sudden, violent, and intense, and are terrifying to the individual experiencing them. Additional characteristics indicative of an aconite state include the following: great restlessness, which can be physical and or mental, and which tends to occur with all types of aconite ailments. There's often a strong thirst for cold or ice cold drinks. In fact, aconite is the only other remedy besides arsenicum listed in bold print under unquenchable thirst for constant sips of cold water. It also lists prominently under desires cold drinks during fever. The skin is often dry and hot, and the mucous membranes are dry too. As noted earlier, the face can be flushed or pale, and like chamomilla and ipecac, there may be one red cheek and one pale cheek. The aconite pains are intense and may be accompanied by or followed by numbness. It can fit neuralgic face pains, heart pains, and sciatic pains. There can be tingling of the extremities. The senses are acute and hyper alert. The respiration is anxious, and foods may taste bitter. In fact, aconite is one of only two bold print remedies listed under everything tastes bitter except water. Now, the two most important aconite modalities are an aggravation from cold wind and cold dry wind, and an aggravation around or after midnight. This is when anxiety, for example, may skyrocket or a fever may spike. And speaking of fever, the aconite fever is a very sudden high fever, often occurring after trauma or exposure to cold wind. The fever is dry and burning with little perspiration and is usually accompanied by fear or anxiety and great restlessness. There may be chills, and we often see a strong thirst for cold drinks. Aconite is the number one remedy for sudden onset of fever after the trauma of catheterization. Additional physical conditions that can indicate aconite include shock, fright, or fever after physical injury, conjunctivitis with copious, thin, watery discharge, especially after exposure to wind, an ear infection with sudden high fever, again after exposure to wind, left-sided facial neuralgia with tingling and numbness, and you guessed it, aggravated by cold wind, and facial paralysis or Bell's palsy with tingling after exposure to and aggravated by cold wind. Aconite is the main remedy indicated for the first stage of croup, with a dry horse cough that is worse around or after midnight. It also fits sudden onset of left-sided pneumonia with fear, anxiety, and cherry red hemoptysis. Aconite also fits a variety of urinary tract and female health problems, including fear of death during labor and delivery, miscarriage induced by fright, and menses suppressed from fright, urinary retention of mother and or infant after labor and delivery, and sudden onset of cystitis with fever, restlessness, and screaming in pain during scanty, hot, painful urination. We always consider aconite in the early stages of cardiovascular events like stroke and heart attack, especially when there's a great fear and restlessness. In angina, there can be numbness, tingling, and lameness of the left arm. We think of aconite in cases of tachycardia from fright, and it is one of the main remedies for cases of sunstroke. A few more aconite conditions include diarrhea after overexposure to summer heat, vertigo that is made worse by rising from lying or sitting, sudden blindness triggered by fright, and blindness during vertigo, and insomnia with restlessness and anxiety that is worse after midnight. All right, now let's finish up with some rubrics that list aconite prominently and that illustrate the many types of aconite ailments that can be triggered by or aggravated by fear and fright, beginning with the general idea of ailments from fright, ailments from fright after seeing an accident, timidity or shyness after a fright, vertigo from fright, head pain after fright, blindness after fright, stomach ache after fright, vomiting after fright, hepatitis from fright, diarrhea after fright, bladder paralysis from fright, bladder retention after fright, miscarriage after fright, suppressed menses from fright, difficult breathing after fright, cough aggravated by fright, palpitations after fright, insomnia after a fright, convulsions from fright, fainting from fright, and lastly, paralysis from fright. Now, before we move on to remedy relationships, I'd like to mention a couple of issues regarding aconite. One is the idea that the patient must be fearful in order to justify a prescription of aconite. In my opinion, this is not true. Yes, in the majority of instances, fear is definitely the predominating feature of the case. However, there are cases where we can detect no obvious fear and yet aconite is still indicated. In such cases, we look for other aconite features, such as an aggravation from cold wind, and sudden onset of intense symptoms in the early stages of an illness. The other issue is the idea that aconite must be given in high potency in order to be effective. I've seen this stated by many teachers and written in many books and articles, but I really don't think that it's true. Yes, it's true that a traumatic fright can penetrate deeply and affect the vital force in a profound manner. Nevertheless, a single dose or two of aconite 30C can also be very powerful. I do believe that this belief in high potencies is a sign of our times. We live in a materialistic age where people trust in the concrete and rely upon power and force to get things done. Some are more willing to believe in very low potencies that may potentially still contain a few molecules or particles of the original substance. But they tend not to believe in something like a 30C potency when they're told that it contains no material substance. As a result, they believe that a 30C is too weak to do the job. Many practitioners like to give high potencies because they're stronger and because people in the modern world like the idea of taking something that's stronger. And some people believe that this applies to all remedies, not just aconite. But the truth is that the potency of a prescription doesn't matter nearly as much as the accuracy of the prescription. This isn't to say that high potencies aren't needed. When a lower potency works but then wears off, it may be time for a higher potency. What I am saying is that I believe in the power of gentle and patient prescribing with the use of low potencies first and stronger potencies later on if needed. All right, now I'm off my soapbox. Let's finish up with remedy relationships. Okay, so the main complements to aconite listed in the literature are sulfur, arnica, and coffea. In reality, I think aconite can be needed in almost any case where a person has suffered from a terrible fright. It doesn't really matter what their other chronic or constitutional remedies turn out to be. Remedies to compare to aconite include arnica, which we think of in all cases of acute shock and trauma. In many cases, both aconite and arnica can be needed. Arsenicum has a similar fear of death, is very anxious, very restless, worse around midnight, and desires frequent sips of cold drinks. Belladonna has sudden onset of high fever, intense dramatic symptoms, and a flushed face. Opium is another remedy for shock and trauma, can have much fear and anxiety, and is one of the main remedies for never well since a traumatic fright. Stramonium is a great remedy for anxiety and the effects of fright, can be very restless, and fits fear of death, fear of suffocation, and claustrophobia. Cannabis indica is commonly indicated for panic attacks, anxiety disorders, and urinary tract infections. Phosphorus is anxious, easily frightened, desires cold drinks, and fits left sided pneumonia. Rustox is anxious and restless and commonly indicated for physical trauma and injuries. Ferrum phos is indicated in the early stages of colds and infections, can have a high fever, and desires cold drinks. Hepar sulf is indicated in the later stages of illness when suppuration is present, unlike aconite. It's also aggravated by cold, dry wind and often follows after aconite. And finally, Spongia is also aggravated by cold, dry wind and is one of a trio of remedies sometimes given in sequence for croup. And those three remedies are aconite, followed by spongia, followed by hepar. All right, that's my take on Aconitum Napellus. Thanks for watching. Please subscribe, and don't forget to tell all your friends and colleagues about the All Things Homeopathy channel. May the vital force be with you.